Hello and welcome to another episode of our podcast. Today we are discussing an important medical topic that many people fear, biopsy. People often hesitate when doctors recommend a biopsy, fearing that it might spread disease or cause more harm. But is there really anything to be afraid of? To clear all misconceptions, we have with us Dr. Maira, a well-known medical expert. Dr. Maira, welcome to the show.
Thank you, Mr. Farrick. I'm glad to be here to address this critical issue.
Doctor, let's start with the basics. What exactly is a biopsy, and why do doctors recommend it?
A biopsy is a simple medical test where a small sample of tissue is taken from the body to check for abnormalities, such as infections, inflammations, or cancer. It is just like a blood test but focuses on tissue instead of blood. Doctors recommend a biopsy when they need a clear diagnosis. Without it, we are only guessing.
That makes sense. But why do people fear it so much?
Fear mostly comes from misinformation. Many people believe that if they have cancer, a biopsy will cause it to spread. This is completely false. Medical research has proven that a biopsy does not cause cancer to spread. It only helps in identifying the condition at an early stage so that proper treatment can begin.
That's very reassuring. But what about friends and family who advise against it?
This is another major issue. Many people listen to relatives or friends who may not have medical knowledge. But medical science disagrees. A biopsy is the safest way to confirm if something is wrong. If nothing is found, you get peace of mind. If something is detected, early treatment gives you a much better chance of recovery.
So in other words, delaying a biopsy could be riskier than getting one?
Absolutely. If you avoid a biopsy and keep worrying about whether you have a disease or not, it affects your mental health. But if a serious condition is present and you delay the test, you may miss the best time for treatment. If cancer is detected early, modern treatments can be highly effective. But if it's detected late, treatment can become more complicated.
Many people fear the pain of a biopsy. Is it really painful?
Not at all. A biopsy is performed with local anesthesia, so the area is numb, and the patient feels little to no pain. It's a quick and simple procedure, and patients go home the same day.
That's good to know. So what's your message to people who are hesitant about a biopsy?
My message is simple. If your doctor recommends a biopsy, don't waste time. Don't listen to myths or uninformed opinions. A biopsy is a safe, important, and life-saving test. It doesn't spread disease and it doesn't cause harm. If cancer or any other disease is present, catching it early increases the chances of successful treatment. The sooner you know, the better your options are.
Well, Doctor, Maira, thank you for sharing such valuable insights. To all our listeners, if your doctor suggests a biopsy, trust medical science, not rumors. Early detection saves lives. Until next time, stay informed and stay healthy.